I would like to inform you that the situation in Thailand is quite similar to what Japan has faced, including that we have increasing medical lawsuit. We have increasing complaint to the Thai Medical Council. And during the past 5 years, the number of doctors who want to be trained in obstetric and gynecology decreased. But later on, it is coming back. 5 years ago, we have about 120 seats for OBGYN training, and not all seats were occupied. But during the past 2 years, we have more applications than the seats that were available. So maybe we are getting better. And we also face about the population problem. We used to have 1.2 million births a year. That was about 10 years ago. But now, last year, we had only 7,300,000 births, almost half of the maximum that we had before. And perhaps you have heard a few months back that Thai government is now promoting our women to become pregnant and to give birth for Thailand. ตั้งครรภ์และคลอดเพื่อชาติ But we need quality pregnancy and quality childbirth and quality child or children for our future of the country. Let me move to the healthcare scheme in Thailand. You know that we have 3 healthcare schemes in Thailand. One is the National Health Security Office, which is covering about approximately 70% of the total population. The other 2 schemes are Social Security and those schemes for the government officer. That is about 30%. We have Act number 41, not 44. Or Act number 41 in only for those covered by National Health Security Office, in which they can claim when there were adverse events resolved from the healthcare. And about half of the claim or requests that were applied, about half belong to obstetric and gynecology, mainly pregnancy and childbirth. So we have the biggest problem among specialties in Thailand. Let me show you the data that we have last year. This is the request to Act 41 in the National Health Security Office last year for 12 months. This is for maternal complications. There were 91 requests for compensation last year. And the main problem was postpartum hemorrhage. And I consider that some of the total abdominal hysterectomy may be also because of the postpartum hemorrhage. But this is what that they assign the cost of the. Most of the requests were compensated. Only very few cases were not compensated. So we also have maternal adverse outcome. What about neonatal complication? We have about 3 times, 312 requests, and the most common one was shoulder dystocia, almost 100. Birth asphyxia, 74. Fetal death, delayed development. I don't know whether I can define delayed development as cerebral palsy or not. Maybe some birth asphyxia later on will be developed to delayed development. So when I first heard about these very interesting activities that Professor Yushiro has been doing during the past 10 years, my first question is that, why only CP? What about other conditions? What about the fetal death? What about other adverse outcome? I think we should have a system that can cover most, if not all, of these adverse events that result from pregnancy and childbirth. So maybe later on, Professor Yushiro can answer why you chose only to cover. Maybe not now, I will finish my talk before. I'm sorry. So this is the situation that, in my opinion, I think covering only CP might not be enough for our situation in Thailand. For the National Health Security Office, we have the system in every province. And the request for compensation start at that level. And if the issue is settled, then it's over. But if the patient or their relative did not satisfy with the decision of the committee at the provincial level, they can appeal for the higher level at the Central National Health Security Office. I don't know whether it is fortunately or unfortunately that I am currently the chair of that committee that look after obstetrics and gynecology and also pediatrics for National Health Security Office, in which, again, about half of this appeal situation belong to OBGYN. I'm very interested in the investigation and improvement system that you also do together with this initiative or this intervention. We also have this type of investigation, but until now, I believe only for death case, not covering morbidity case, but in some region, for example, my region, we are also covering what we call near miss, either maternal or neonatal. I think that will be better so that we can learn more and we can prevent more in the future. So we are having some form of investigation and feedback and prevention in the future, although not very effective and very comprehensive. This Act number 41 cover only for people belong to National Health Security Office, which I mentioned before that it is about 70%. The other 30% are not covered by this compensation. I heard that the government tried to unify these three schemes, but until now it has not been successful yet. The major issue that Dr. Supachai and some of us are considering, I'm very much interested in implementing your experience here in Thailand. But maybe, as I mentioned earlier, to cover more issue than cerebral palsy. But the issue that we have to discuss and decide more is about the financial. Who will pay for this insurance? We have to discuss. At least we have some form of Act 41 that we have some money for this. But that is another issue that we have to discuss further. I will stop here, Dr. Supachai, so that the floor can have more discussion.